Okay. So today we want to look at a topic that personally I'm very invested in. We want to look at migraines. Yeah, we're going to look at migraines. So to start off the conversation, we just want to understand what exactly migraines are. When someone says, "Oh, I have a migraine," what is it, and how different is it from the normal headaches that we know?
Okay, yes. So the headaches, we have two types: primary headaches and secondary headaches. So commonly is the secondary headache. That means it's a different condition. Maybe you have an infection or malaria or something that's causing the headache. With primary headaches, the main disease is the headache, and that's what a migraine is. Yes, so it's more of a neurological disorder, and usually it comes with a pain in one side of the head. It's usually not the whole head, usually the left side or right side. Sometimes it switches, sometimes it's always on one side for the individual, and it can last from between 4 hours to up to 3 days continuously. Yeah, so that's usually the migraine headache, and depending on the individual, it can come very frequently or not so frequently.
What exactly causes these migraines?
Okay, I don't want to put it as causes. I would rather want to say maybe risk factors.
Okay.
And then we'll go to the triggers. So risk factors, if you have a family history, if you have members of your family, most often you are likely. But there are some people who don't have any family history but still get the headaches. Then we have age. Usually it starts from around the adolescent age, and it gets to a peak around age 30, and then sometimes the severity comes down with age. Okay.
And the severity comes down with age.
Sometimes.
Oh, okay.
Yes. Then another thing is the sex. It affects women 3 times as more than it affects men. And then if you have certain medical conditions like epilepsy, sleep disorders, sometimes depression, anxiety, you might also have this as well. And then the use of certain tobacco products, as usual, cigarette smoking, the vaping as well, and other things that they might put in to smoke. How do you call it? Shisha. Yes. So those things can also be a risk factor to lead to developing migraine headaches.
Okay.
Yes.
So how would I know this is a migraine? It's not a normal headache, but how I'm feeling is a migraine. Are there any tests that I have to undergo, or how exactly are you able to tell that this is a migraine and then this is just a normal headache that will pass away? Or that,
okay, so now we are moving to
diagnosis. Yeah.
Yes. Okay. So in diagnosis, it's more of a diagnosis of exclusion, if I should put it that way, because aside the symptoms, what I mentioned earlier is one-sided. It happens frequently, and it can last between 4 hours to 3 days. Aside that, and usually it's from moderate to severe. It's never a mild headache. Yes. So aside that, you'd have to rule out other causes of headaches. So other primary headaches like cluster headaches, tension headaches, we'll rule those ones out, and we'll rule out secondary causes. A common cause is sinus problems. Some people have a chronic sinusitis. That might be the cause of their frequent headaches. So we have to investigate and rule all those ones out. So we usually do that with blood tests. Then we might have to do scans, CT scan of the brain, and then see if there's anything structurally going on, because migraine headache is strictly a functional issue of the brain and the pain pathways and the blood vessels. It's not actually a structural issue. So if you do a scan and you see a structural issue, then probably it's not migraine headaches. So once you rule all those things out, then would classify you as having migraine headaches.
So if I'm getting you correctly, the tests or scans or whatever it is that you're undergoing, it's not necessarily to confirm that it's a migraine, but you are trying to get to the root cause.
Yes, so you are ruling out other causes.
So you'll be able to identify. Yeah. Okay. So let's look at it. If someone is having a migraine, what are the phases that the person goes through in an episode? How does it start, and then at what points do we say that, oh, this is like the height of the migraine, and then when it's subsiding, how are we able to tell?
All right, so we call it a migraine attack. So the first stage, that's what we call the prodromal stage. So that's where, before the headache itself comes, there would be some slight changes. Sometimes there might be constipation or mood fluctuations or neck stiffness, some non-specific, so sometimes they might urinate too frequently, sometimes they might not be able to sleep well, sometimes they might have difficulty concentrating, so some very non-specific mild changes in their behavior. Yes, so that's the prodromal stage. Yes. Okay. Then we have the aura phase. So that's just before the headache comes, about 20 minutes or maybe an hour to an hour before the headache comes. They have these sensations like sometimes they can't even tell you what exactly they feel, but they know that the headache is about to come. They feel it. Sometimes they'll have muscle weakness, sometimes they'll have maybe flashes of light,
disorientation, and then
not maybe they will have difficulty concentrating and like carrying on a conversation, but not necessarily disorientation in that the actual definition of it, but sometimes they have tingling sensation, numbness in some parts of their body, sometimes they have a ringing sound in their ears. But the aura does not happen in most cases. It happens in 1/3 of people. So some people don't even have the aura phase at all. Yes. So they just go into the actual headache. That's the 3rd phase. So the headache phase or the attack phase. And that's when they have the moderate to severe headache that is persistent. They usually say it's throbbing or it's pulsing in nature. Yeah. So it's the intensity can range. And usually they have high sensitivity to either light or sound or touch. So they are very sensitive during that period of the attack. Yeah. And then we have the post-drum phase, where after the headache is subsided. Yes, immediately after, they might feel very exhausted. They might feel sluggish. They might feel sometimes they call it like hangover effect, as if they were drinking and the next day, that kind of thing. Yeah. So they have those kind of things. Sometimes they might be confused as well after the headaches, or fatigue, neck stiffness. Sometimes there's also nausea associated as well.
How do we treat migraines?
Okay, so let me talk about the non-medical treatments first. So you can maybe apply a warm or cold wet towel over the head. Yes, sometimes they massage the scalp. Sometimes they sit in a quiet, dark room. Sometimes too, they say you can put your feet in warm water to relieve the pain.
What about putting your head under running water?
Well, it's
for the cold sensation.
Yes. So that is the same as applying
the cold
the cold towel. Yes, to just reduce the temperature on the scalp. Yeah. You can take over-the-counter pain medications like the normal paracetamol, brufen, those combinations with the caffeine in it. Yeah, so those ones help, but you can't be taking it too often. If you're having the headaches every day, that is not the best option for you. But if it's maybe once a month or something, yes, you can take that. Then we have the prescription medications that we give. Those ones you have to get it from a specialist, the triptans and those other specific ones. You get them from the specialists, the neurologists. And then they you take that as and when you have the headache. To relieve the pain. Then we have medications to prevent the headaches. They don't always work, and there are a variety of different types that different people use. So sometimes the anti-seizure medications help. Sometimes some beta blockers to reduce the heart rate also helps. Sometimes there are other, should I say, monoclonal antibody medications.
Please come down to our level.
I don't know how else to say it, much simpler than that.
Monoclonal what? Antibody medications.
Yes. So sometimes antidepressants also can be used. So it depends on the individual and how they respond to the kind of medication. Yes. But if your headaches are not that frequent, we don't really want to prescribe those medications because it's long-term medications.
Okay. I was gonna ask you that, how would you know which medication would work for you? Because when we started the conversation, I mentioned that this topic is very particular to me because I suffer from migraines. I went to the hospital and I was told it's a side effect of one medication I'm on. So that is what brings the migraine. And then the doctor said it's either they give me medication to control it, or I just go through go through the phase. And I'm just asking, like, how would you know which of these methods would work for you if you are trying to control your migraines, or you're trying to, get better?
That is something every individual has to discuss with the specialist that they are seeing, and then they tailor make it according to that individual, because there are so many different things that are associated with the migraine. Some people, it's hormonal, so it has to do with their menstrual cycle. Sometimes when they go through menopause and other things, sometimes it's due to stress. Sometimes there are various other things. Sometimes it's diet. So sometimes you see there are specific foods that actually trigger these things. So it's a long discussion you would have to have with the specialist.
So it's not something you can just sit in your room and decide that, I will do this or I'll do that.
You need to talk with a professional, and you go through a lot of things before you finally come up with the final solution. It's not a simple thing to just decide that this medication
would work for me.
Yeah.
But then finally, we want to look at if there are any lifestyle changes one can make to sort of reduce the incidence of these migraines, or prevent it from even happening to somebody at all.
Okay, so just want to mention that treatment of migraines, there's no cure for migraine headaches. It's just, if maybe there's something triggering it, you can remove it and it stops. That's fine, but there's no cure exactly, because it's not well understood as at now. So the best thing we do is we do tracking of the headaches. So we have what we call a headache diary. So when you take the headache diary, you have to take, anytime you have the headache, you record the time, the time it started, the date it started, the duration of the headache, severity. So you scale it from 1 to 10. You describe the pain, the location of the headache, right side, left side. Then you also document symptoms. If you're having nausea, sensitivity to light, or you're vomiting or anything, then you also document the suspected triggers. So if you think, is this food you ate, or is this medication you took, or this herbal preparation, or you took this recreational drug, or you were engaged in a certain activity. Yeah, so you have to take note of all those things and then write them down. And then you also write down what medication you took that helped with the pain, or what medication you took that didn't help with the pain. So once you have all those details, you look at it, and then you are able to figure things out, and then track patterns that you can tell. So that's a very important thing you have to do if you're having migraines. That can actually help you to tailor down your treatment regimen, and to know what exactly to avoid and how to get better. Prevention, if it's triggered by something you can find from your diet,
then you just stop eating it.
But I don't really know of anything as at now that you can do to cure or prevent any further migraines, aside monitoring yourself closely.
Okay. Are there people who in their lifetime would never experience migraines?
Oh yes, of course.
Oh, okay. So it's not like a normal thing.
No. It's actually in general, probably less than 20% of the general population actually has migraine headaches.
Less than 20% of the general population.
Yes.
Okay.
Okay, but one last thing I want to say is, if you see certain signs, even if you tend to have migraine headaches, if you see certain signs, you have to rush to the hospital. First of all, if you have what we call a thunderclap headache, they describe it as like the most severe headache in their whole life, like
the one is a mitibom.
Yes, usually it's associated with a high blood pressure, and it's associated with bleeding inside the brain.
Oh,
yes. So if you are having a very, very severe headache, most severe of your life, and that kind of thing, please rush to the hospital. If you are having seizures, you are having problems with vision, you can't see during the time you're having the headache, or you can't even talk during the time you're having the headache, or you can't stand up straight and walk straight because of how severe the headache is, please get to a hospital as soon as possible. Maybe there is something else going on, or something more severe is coming up.
Okay, but I'm just asking a follow-up with what you said. How severe is severe? Because everybody responds to pain differently. I might feel a type of pain, and to me that's like the worst pain I've ever felt. and then another person, you describe the pain to the person, and the person is like, I say wait, so I'm just saying, how would you know that this is cause for alarm, so I need to get to the hospital?
Okay, so aside the fact that the person would be telling you that this is the most severe pain he has ever had in his life, you might realize the breathing is fast and the pulse rate too gets very high.
Okay.
Yes, but aside that, the best thing to do, don't underestimate the person's pain and say you are always exaggerating. If the person tells you that this is very, very severe and he's worried or he's panicking, take him to the hospital and let them just check.
Okay, all right. Thank you so much, Doc, for having this conversation with us. So that was Hello Doc with Dr. Emefa Dzide.